The U.S. Surgeon General now warns America's young people are on the brink of a public health crisis. It's not drugs, it's not alcohol, it's their mental health. And the pandemic has made things even worse. Today's advisory revealed symptoms of depression and anxiety doubled among young people during this pandemic. Doubled. 25% now show symptoms of depression, 20% anxiety. And data earlier this year showed suspected suicide attempts were up compared to 2019, especially among adolescent girls. The Surgeon General cautioned, quote, "It would be a tragedy if we beat back one public health crisis only to allow another to grow in its place." Let's bring in a psychiatrist tonight to help us walk through all this. Dr. Jessi Gold joins us again, assistant professor at Washington University School of Medicine in St. Louis. Dr. Gold, the Surgeon General is really worried about the mental health of America's young people, calls it a crisis. Usually the warnings are about cigarettes or cancer, really important stuff. But how bad is teen mental health?
I was really glad he said something. As somebody who works in the trenches, so to say, I think it's something I've seen every day. We don't have enough providers. We have a lot of need. It's only getting worse over COVID. And that's something he really said was this was a problem before. It's only going to get worse after. And if we don't do something about it, that's when it's really going to be a problem. And I think that's a really important thing for him to have said.
So we're not just talking about kids and I'm not trying to downplay it here, but they're anxious because they're looking at Instagram or something like that. Like, it's worse than that.
Yeah, absolutely. I mean, I think we have high rates of depression. We have kids with suicidal thoughts. That's increasing in younger people, but you also see that particularly in people of color. We are also seeing, the way that self-esteem is affected by things like social media and Facebook. We saw some of that data come out. I think that probably has more of an effect than people realize, and that was in his report as well. So I think anxiety can obviously take over your life and be something that's really serious, but we've seen kind of the spectrum of things, and I think that's part of what's important is we need to see the spectrum of things and be preventing the really serious things from happening because we recognize it.
I want to ask you about the most severe cases because there is a difference between something that can be deadly and something that is, maybe treatable. It's a malaise or something like that. In Oxford, Michigan, this 15-year-old is accused of killing 4 classmates in a shooting. Again, he's 15 years old. And it just has opened up this conversation about school counselors in general, because there they recommended a screening within 48 hours, but he was allowed to stay in school. In general, how well equipped are school counselors to screen all the students at such a large scale?
It's a really good question. I'm not a school counselor, so I can't speak from them from experience. But, in talking to school counselors, I've heard that it's very varied in how they're trained to assess dangerousness, in how comfortable they feel in doing that, and in the resources they have, because they're really overrun as is. I think the ratio people want in school counselors is like 1 to 500 kids, and it's about more like 1,400 to 1 in this country right now, which is just so many people per counselor. And if you're dealing with that big load of people and maybe you have a certain amount you're most concerned about, that's still going to be a big number. And it's just a lot of people to worry about over like a short period of time with probably not enough support for them to deal with it, during the day, or to have someone else back them up, or burnout too, I think.
Well, and you think of the most common illnesses. Some of my friends, they have children going through this right now in middle and high school. Depression, anxiety, autism. In a lot of those cases, you want them to be in school because you want them socialized. That's probably the best place they can be. And I would think even maybe suicidal children, it's good to maybe have them be around people rather than seclude them, make them feel like, you're bad, something's wrong, we're taking you away. When should we know to remove a child?
It's a good question. Dangerousness is one of the hardest things that we assess, and it's one of the hardest things I do in my job too. In training, we work in the emergency room in psychiatry, and I can remember multiple cases where it just feels a bit like a coin flip, where you're doing the best you can to know what the answer is, but the data isn't so good on our ability to do risk assessments. And so you're doing the best you can with how you're taught and your gut feeling, but what does that really mean, right? And I think when you think about who needs to be pulled out, I think you're probably going with that, which is a bit of what is imminent risk. Is somebody at risk right this moment? Is that person at risk themselves or other people? Versus are they just talking about some things that they've talked about before and you could support them through it? Versus like, you know, their parents can tell you all about what's going on and that's just what's been going on and they need to be in school because that's where their support is. I think having parents involved is really important, and knowing sort of the trajectory of the kid is probably a good way to tell if somebody needs to not be in school, because they can say like, okay, my kid was not like this before. This is really, really different, or I can pay more attention to be able to see how this has changed over time, and I can be more involved to do these things. And I think that that's a big part of it too.
Mm-hmm. It seems like what you're saying is awareness from parents, from kids, from the Surgeon General, whether it's diagnostics or treatment. It's important to just be plugged in. It's a really, really tough field. I appreciate you going through some of this. Dr. Jessi Gold, again, coming back. Thank you so much.
Thanks for having me.